Hi, this is Dr. LOKESH. I'd like to submit today about emergency medicine, minimum PG seats for each medical college or hospital, comparing minimum standard requirements uh, followed by United States ACGME who give the guidelines. I'm going to share presentation. So emergency medicine uh, medicine PG seats, minimum six, requesting six PG seats per year for every medical college, every hospital. Total 18 in 3 years by NMC, every medical college. This is, I'm going to share some ACGME guidelines. We request NMC sanction minimum six PG seats for every medical college who has PG seats in emergency medicine given. And we request look at ECGME, and this is presentation to the committees or leadership to make a decision. By implementing a minimum 6 MD or minimum 4 DNB in each medical college or hospital, we can create total 836 PG seats in emergency medicine across India. Current hospital, just one row. So let's go to the number. Out of 185 colleges, if you can grant 6 PG seats, that will total 1,115. And so they can create extra 455 seats, just changing this rule. In DNB seats can also increase to 4 minimum. Currently, they are only giving 1.8. So that also can give 286 seats. Total, we can give 836. So before that, I'm going to go and present what is the current numbers. I wanted to mention that emergency medicine, MSR minimum standard requirement should be different because medical medicine pediatrics have a floors, but emergency medicine is a 24-hour operation, so they cannot compare. You need to have separate minimum standard regulations to emergency medicine. There are 3 8-hour shifts or 2 12-hour shifts, so they need to staff and faculty-wise supervision, and they also need to have holidays at least 1 or 2 days per week and 4 weeks minimum vacation as per NMC guidelines. And also this is 365 days continuous work patients coming in. Number of patients should be triaged, should tend to either admissions, critical care, ICU, surgery, or home. And there's a lot of work. Some of critical care patients take a lot of time and a lot of faculty. It's the number of patients in each emergency medicine is one of the major rules they follow in ACGM in the United States, a major factor. And I'm going to share some more information. So in USA, about the PG seats, how many USA PG seats? We have 292 hospitals or 3,068 PG seats. If you go and look at the NRMP data, you will be accessible. So average 10 seats per hospital. Whereas in India, we have only 3.5 seats in medical college, MDs, 3.5. But they have a rule. They ACGM have minimum, they can give 6 PG seats, minimum. So out of 185 colleges, only produce 660. If we can make this rule into the 6 cities, it will go up to another 500 seats more. In DNB, we have 137 hospitals, have 254 seats, average 1.8. This also can be got at least 4 seats, at least 12 total in each program. So how do they follow? This is what I got it from ACGME guideline 1.7F. Patient population must include patients in emergency room, broadly represent society with a wide variety of clinical problems. So they need to see the pediatrics, adults, OB/GYN, etc. And other main thing is they will give only programs which a hospital have 30,000 emergency department visits. That means 82 visits per day. Then there is the minimal qualification. And also they grant 6 PG seats in that hospital. They also need a critical care patient, at least 4 critical care patients per day or 1,200 in order to give a residency program in this. This is the United States ACGME criteria. Program director, they have only one program director. They don't have our, like in India, we have a professor, associate professor, assistant, CR, SR, that is 4 people. But here, program director will supervise. And program director experience is at least 3 years document educational administrative experience. Not like we have assistant professors maybe 4, 5, 6 years before become associate, another 3 become 8 years before become professor. So that restriction is not here. And a program need not be professor, associate professor. This is what I mentioned just now, does not require program director to hold a specific academic title, but they need to have specialty certification in clinical activity experience. So faculty in emergency room, what is the number of faculties for PG seats they calculated? So they have minimum one core physician faculty member for 3 residents. That means even this core physician has to work like not 24, not 40 hours, maybe another 10 hours given for administration. So even if I take one professor, associate professor, assistant, and senior residents, there are 4 of the faculty in India. 4 can do at least 3, that is 12. But again, each emergency room PG will spend 7 months a year, but other 5 months, 1 month vacation, other 4 months going to be um, in pediatrics or anesthesia, etc. So that give 4 faculty in emergency medicine can give up to 20 PG seats, at least 6 minimum PG seats per year, that is 18 or even more. So I'd like to present this information to emergency medicine faculty across India and NMC and core committees. Take this information, hopefully grant at least minimum 6 PG seats for every medical college minimum, and DNB seats, at least 4 minimum DNB seats will be needed if you like to equal to the ACGME of United States. Thank you so much.